guys, my name is Olive. I'm a student at African University. I'm a final year and I'm doing international relations. I'm going to talk about drugs, how to understanding drugs use and addiction drug fate. People from all walks of life can experience problems with their drugs use regardless of age, race, background, or the reason they are started using drugs in the first place. Some of people experiment with recreation drugs out of curiosity to have a good time because friends are doing it, or to ease problems such as stress, anxiety, or depression. However, it's not just illegal drugs such as cocaine or heroin that can lead to abuse and addiction. Prescription medication such painkillers, sleeping pills, tranquilizer can cause similar problem. In USA, people are using marijuana, prescription painkillers from overdosing powerful painkillers each day. They from traffic accidents and people can also die. Addiction to opioid painkillers can be so powerful, and it has become the major risk factor for heroin abuse. Many people don't understand why drugs or how other people become addicted to drugs. They may mistakenly think that those who use drugs simple or willpower, and that they could stop their drugs use simple by choosing to do not use drugs. Drug addiction is a complex disease, and quitting usually takes more than good intention or strong will. Drugs change the brain in ways that makes quitting hard, even for those who want to. Fortunately, researchers know more than even about how drugs affect the brain, and have found treatments that can help people recover from drug addiction and lead productive lives. Secondly, I'm going to talk about what is drug addiction. Addiction is a chronic disease characterized by drug seeking and use that's compulsive or difficult to control, harmful consequence. The initial decision to take drugs is voluntary for most people, but repeated drugs use can lead to brain change that challenges an addicted person's self-control and interfere with their ability to resist intense use how to take drugs. Those brains change and also can persist, which is why drug addiction is considered as a disease. People in recovery from drugs use discover us, or is increasing also risk for the returning to drugs use even after years of not taking the drugs. It's common for a person to replace, but replace doesn't mean that the treatment doesn't work. As with other chronic health conditions, treatment should be going and should be adjusted based on how treatment plans needs to be reviewed often and modified to fit the patient changing needs. And I'm also going to talk about what happens to the brain when a person is taking drugs. Most drugs affect the brain's circuit, causing euphoria as well as folding it with the chemical message dopamine. A properly functioning reward system motivates as a person to repeat behaviors needs to thrive, such as eating and spending time with loved ones. Such of dopamine in the reward circuit cause the reinforcement of pleasurable but ineffective behaviors like taking drugs, leading people to repeat the behavior again and again. As a person continues to use drugs, the brain adapts by reducing the ability of cells in the reward circuit to respond to it. This reduces the height that the person feels compared to the high level of his health. They might take more of the drug and also try to achieve the same high. Those brain adaptation is often causing some leads to the person to become less and less able to derive pleasure from other things they once enjoy, like food, sex, or social activities. Long-term use also causes change in other brain chemical system and also in the circuits as well, affecting functions that include learning, judgment, decision making, stress, memory, behavior. So the people should use drugs to continue to take them, which is in the nature of the addiction. Why do some people become addicted to the drugs than others? No one the factor can predict if a person will become addicted to the drugs. A combination of factors influence risk. First, for addiction, the more risk factors of a person has, the greater the chance that taking drugs can lead to addiction. For example, we have biology. The gene of that people are born with an account for about half of a person risk for addiction, gender, and also ethnicity, and the presence of other mental disorder may also influence risk for drugs use and also the addiction. And also the second major is the environment. A person's environment includes many different influences from family, from friends, to economic status, and also the general quality of life. Factors such as a peer pressure, physically and sexual abuse, early to exposure to the drugs, and also stress and parental guidance can greatly affect a person. Genetic and also environmental factors interact with a critical development stage in a person's life to affect addiction risk, although taking drugs and any age can lead to addiction. The earlier that drugs use begins, in the more likely it will progress to addiction. This is particularly problematic for them because some area in the brain that control decision making, judgment, and self-control are still developing. Then they can also be too prone to risk behaviors, including trying drugs. And I'm going to talk again when drugs use becomes drugs abuse or addiction. Of course, drug use, either illegal or prescription, doesn't automatically lead to abuse. Some people are able to use the recreational or prescription from a doctor without doing any experience negative effects. Others find that substance use takes as a serious toll on their health and well-being. Similarly, there is no specific point at which drugs use moves from casual to problematic. Drug abuse and addiction is less about the type or amount of the substance consumed or frequency for your drugs use, and more about the consequence of that drugs use. If your drugs use is causing problems in your life, at work, school, home, or in your relationship, you likely have a drugs abuse or addiction problem. If you are worried about your own or your loved one drugs use, learning how drug abuse can addiction develops in why it can have such a powerful hold will give you a better understanding of how to give a better deal with the problem and the regain control of your life. And also we should also recognize that you have a problem is the first step of the road to recovery. One of that takes tremendous and courage and be also strange, facing your problem without minimizing the issue of making excuse and also feel bad. Recovery is with a reach if you are ready to seek help, and also you can overcome your addiction and build a satisfying drugs-free life for yourself. And also I'm going also to explain about the risk factors for drugs addiction. Anyone can develop problem from using drugs. Vulnerability to the substance addiction differs from person to person. And also it also comes from your gene, mental health, family, the social, environmental, all play a role. Risk factors that increase your vulnerability include family story of addiction, abuse, neglect of the traumatic experiences, a mental disorder such as depression and also anxiety, early use of drugs, method of the administration, smoking or injecting a drug may increase its addictive potential. Can drug addiction be cured or prevented? As with most other chronic diseases such as diabetes, asthma, or heart attack, some disease treatment for drug addiction generally isn't it cure. However, addiction is treatable and can be successfully managed. People who are recovering from an addiction will be at a risk for replace for years and years and possibility for their whole lives. And also the treatment approach tailored to each patient's drug addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, harmful consequence. Brain changes that occur over time. Brain changes that occur over time with drug use, challenge, and addicted person self-control, and interfere with their ability to resist intense urge to take drugs. This is why drugs addiction is also a replacing disease, that it returns to drug use after an attempt to stop. Replace indicates that the need for more or different treatment. Most drugs affect the brain, reward circuit by folding in with the chemical messenger dopamine. Surge of dopamine in the reward circuit cause the reinforcement of the pleasurable but ineffective activities, leading people to repeat the behavior again and again. Over time, the brain adjusts to the excess of dopamine, which reduce the height that the person feels compared to the height they feel when the first taking the drug, an effect known as a tolerance. They might take more of the drug, trying to achieve the same dopamine high. No single factor can predict whether a person will become addicted to drugs. A combination of genetic, environmental, and development factors influences risk and for addiction. The more risk factors a person has, the greater the chance that taking drugs can lead to addiction. Drugs addiction is treatable and can be successfully managed if the person is a volunteer. More good news in that drugs use and addiction are preventable. Teachers, parents, and healthcare provide and the critical roles in educating young people and preventing drugs use and addiction. Thank you guys.